How's it going, everyone? My name is Garrett Oyama, and I'll be your speechtherapypd.com host for this podcast series entitled Converging Careers Interprofessional Practice for Speech Therapy. Just a bit of background. I've always been kind of at the junction of different fields as an SLP and a musician, and I was a CogSci research coordinator. So it's really a passion of mine to try and bring together insights from different fields to show how they might make our work as SLPs more effective, and just to kind of be interested and wowed by the beauty of science and studying this amazing thing that we don't fully understand yet, which is language. So I've kind of doubled down on the music thing, being a musician myself. So, but I think we'll get a slightly different take today from a cognitive scientist who's also a PhD student at my alma mater. So shout out to UCSD Tritons. And I met Dr. Slevc at a recent symposium at USC on brain, sound, and music. And I was really just blown away by his talk. And I thought it'd be really cool to bring him in, and excited for you to get to know his work. So just a little introduction. Dr. Slevc is an associate professor and associate chair in the Department of Psychology, as well as part of the program in neuroscience and cognitive science at Maryland Language Science Center. And he received his PhD at UCSD and was a postdoctoral scholar at Rice before coming to UMD. And his research focuses on the cognitive mechanisms involved in the processing of language and music in both normal and brain damaged populations. So before we get started, just a couple of items to alert you to. This course is an hour and will be offered for 0.1 ASHA CEUs. As far as financial disclosures go, we each get an honorarium from speechtherapypd.com, but there are no other non-financial disclosures to report. And without further ado, so excited to welcome the amazing Dr. Bob Slevc. Welcome to the podcast.
Thanks, Garrett. That's a really nice introduction. I would have done it, just for that intro.
Right on. Well, we'll get into the weeds in a second, but I was wondering if you can just maybe starting out, tell us a little bit about yourself. What's your superhero origin story with regards to your work in language, music, and the brain?
Yeah, well, I was bit by a radioactive piece of sheet music, and no, I don't know. How did I get into this? A long time ago when I was in college, I was interested in language, but I didn't know anything about like linguistics or the cognitive science of language. So I was like studying language. In fact, I ended up majoring in Chinese, which is slightly embarrassing to say because I don't really speak Chinese, but I did manage to get a degree in it. And one of the things that happened is that I got really curious about why some people were so good at learning Chinese and I was less good. And some other people were like terrible at it, right? And it was just really interesting because it sort of felt like, in a lot of the classes I went to, you sort of had this sense where like, oh, some people can like learn chemistry and some people like don't really learn chemistry, but it's like they don't really try, right? And in learning language, I really got the sense that some people were trying really hard and having a lot of trouble. Some people were not trying that hard and like do it great. So I got interested in individual differences and in adult second language learning and why it's hard to learn second languages as adults anyway. And I've also had a lifelong interest in music, and somewhere along the line, how did this happen? I think it actually happened because of a course scheduling problem. I ended up taking an honors seminar where you had to like propose an honors project, and so I met up with a guy who did some stuff relevant to second language, and we got to talking, and we ended up doing a project on whether musical ability might predict some of the variance in adult second language learning. And it turned out it did, and it was a pretty fun experience, and I got really interested in sort of cognitive research, and I ended up going to grad school, and there you go. At that time, I really kind of wanted to go to study music cognition, but I got a lot of advice that was kind of like, well, it's a little fringy. You might never get a job. Like, if you like language, maybe better to focus on that. So I went and got a PhD doing, studying psycholinguistics, and I actually went to UCSD because there's a person there named Diana Deutsch, who's like one of the sort of OG music cognition people, right? And I was like, I'm going to go over
her actually.
I
actually just met with her a week ago.
Oh, nice. Yeah, she's lovely, right?
She's really cool. A lot of great stories.
Yeah, she is super interesting. And so I went there because I wanted to work with Diana, but like at the time, Diana was kind of like I don't know, she wasn't like super research active. She was sort of like playing around and coming up with musical illusions and stuff. And I met this other guy, Vic Ferreira, who I really got on well with, who studies language production. And so I ended up working mostly with Vic. Did some side projects with Diana, which didn't really go anywhere, but they were fun. It's sort of
That's
my
amazing.
aspiration to, she has like a whole studio in her like amazing house in La Jolla, and I'm like, that's like the life right there. If you can,
That's the goal.
yeah, but
Yeah, that's so funny. Yeah, I just met with her, about a week ago, and she was in her studio, and just like it really felt like she was just having the time of her life, like playing around. She kind of reminds me of like an Oliver Sacks or something, like almost like a
yeah, she's,
philosopher. Um, yeah,
yep,
uh,
yep. And she's just kind of at that fun stage where she's just like thinking about what she wants to think about, and she's kind of got the resources to do it. It's pretty cool.
yeah, that's
Yeah, I mean,
awesome.
she's, she has all these amazing musical illusions that she's come up with and sort of figured out over the years, and um, they're very cool.
Yeah, I'd love to talk about. I think one's particularly relevant to some of the things that we might discuss. A lot of them are at the intersection of music and language, but one in particular that would be cool to talk about later is the speech to song illusion, where I think her story is that she was listening to her tape to try and get these illusions ready for her book that were coming
Yeah,
out
well,
with her book.
she actually released a couple of CDs of these illusions, and so
Yeah,
it was some of her like intro text that she was just kind of, like sometimes when you're checking the, when you're going to put something out, you just kind of run it on repeat a few times, kind of figure you'll notice if there's any weird popping or anything going on.
yeah. And then all of a sudden, she started to hear this singing voice as if someone was singing to her. And she's like, what is that? And it happened to be just her on repeat.
Yeah,
And so, yeah.
yeah, it's
Um,
cool. I mean, and it's like you don't it doesn't need to be just that one case. So there's a bunch of folks who've been researching it using audiobooks, and you can just take these chunks of audiobooks. It doesn't work for every phrase, but like I think what happens is, if you repeat it enough times and you stop attending so much to the sort of linguistic content because you've heard it 4 times, 5 times, 8 times, 10 times, and you start attending more to things you don't usually attend to in speech, right? The pitch and the intervals and the sort of rhythm, and then like when there's something that you can kind of process musically, you sort of latch onto it. They're great examples. And then it's fun because some of these, I've listened to Diana's example enough times from classes and stuff that even if I just hear it, I can't hear it as just regular speech. It just sounds to me like she just bursts into song for like halfway through her sentences.
yeah.
It's totally great.
Yeah. Well, I mean, that really gets into the kind of the meat of what I wanted to talk about, which is, you started your talk at the symposium with this provocative question of, what is music? We have this idea of like, someone playing a Bach concerto, like that's music. But, when you break it down, there's this continuum, and there's not a great place that we can divide it up.
Yeah, I mean, we treat them like they're these separate domains, right? But like, I mean, I don't know. Bob Dylan won the Nobel Prize for Literature. That's like a little cheating because you're like, well, it's like the lyrics or something. But like, I don't know, what's rap? What's poetry? What's spoken word? Um, uh, it it's like any kind of definitional criteria you come up with, it's really hard to like draw a line where you're like, okay, I can just categorize the world into language and music. You can find endpoints, right? But I don't, I don't know if they're natural kinds, right? They seem more like I don't know, dimensions of sort of how we like interpret the auditory world in like meaningful ways, right? I mean, I think you can say there's something different about music and like a car driving by, right? That's auditory world and that's meaningful in a sense, right? But it's sort of a different thing, right? So it's not just recognizing auditory objects, but there's a lot of similarities, right? And so I think maybe that's why it's hard to distinguish them sometimes. I
Yeah.
mean, that said, in the sort of field, we do it all the time, and we're just like, oh, okay, well, here's some Bach chorales, right? We all love Bach chorales because they're so well characterized with music theory, right? And then here's like some weird syntactic sentences or something. But
Right. It seems so obvious when you put them, into those categories, but when you really try and like cut it down and find that exact place where one ends and the other begins, it starts to get a little bit fuzzy, which is kind of cool.
yeah,
Um,
well,
you
especially if
know,
you think about it either evolutionarily, right, which is like one thing people like to speculate on. Where did they come from? Like, are these separate things? Did one kind of come out of the other? Did they sort of diverge over time? But also just developmentally, right? I mean, you know, you take a baby and it's like, well, here's some people, I like conspecifics, and they make some sounds. Like, how are you supposed to know that some of those sounds are singing and some of those sounds are speech? And
Yeah, right. Yeah, there was something that you said that was so cool. It was like something I'd been thinking about and wondering about for a while. But like, I think you said that, correct me if I'm wrong. But basically, kind of at first, everything is, music or like organized sound, at least. And then um, the musical kind of non-linguistic aspects of the sonic environment are kind of processed first or all together, and the musical ones are probably easier to process because the speech cues, the syntactic cues are a bit harder to find those patterns. They're a bit more difficult. So then it's sort of like speech gets understood as this type of music or organized sound that basically gets differentiated based on like the context that these two things are learned in. So, music, you're playing, you're having fun, you get to like do certain things with your voice. And in speech, there's these more meaningful cues that, maybe afford different actions in the environment. So you imitate something, then something really specific in the environment changes. Is that correct? Am I
Yeah,
getting that?
yeah. I mean, I think that's I don't know that that's completely uncontroversial, but it's something that I've argued and with some colleagues. Actually, a very fun paper that I wrote a long time ago with a colleague named Tony Brandt, he's actually a composer, a professor of composition at Rice. No particular background in science, but he's just like very enthusiastic, and it was like a really fun paper to write. But yeah, we've sort of argued that like it's not even necessarily that like language and music have these different characteristics and you have to learn to differentiate them. It's sort of like, look, there's sound that people use, and then some of the sounds that we use, we've kind of got conventions about how we use them, right? Because in order for language to work, it has to be pretty conventional, and it can't be, people are creative with language and it changes, but relatively slowly compared to music, right? Because it has to, you want to be able to talk to people from a different generation. It doesn't work if they're like, I mean, I'm getting old enough that I'm sort of beginning to see that break down. I also work in a college, right? I'm like, what are you people talking about?
Yeah.
But it evolves slowly. But you can play more with the musical elements, right? And so one argument is that like what music is it's just it's the fun stuff that you get to play with in the sort of in this kind of signal, right, between people. That isn't quite as constrained by kind of communicative pressures and like whatever, like the sort of syntax and the whatever, all the other stuff that you have to do in language to actually make it as specific as it is. Um,
Yeah. Yeah.
but if that's true, right, then it's like it's really a kind of gradual specialization over development.
Hmm.
And there's some kind of interesting work. Like it turns out that if you ask kids, like to characterize different things, say, is this speech or is this song, right? Like adults will use certain characteristics. Kids will often use different ones.
Oh,
There's
that's
some,
interesting.
yeah, I'm trying to remember exactly what it like. I think one of the cues that kids use a lot is volume.
Hmm.
That like song is louder than speech, which is not a cue that adults would use. But I guess if you're a kid, like when you sing, you like really belt it out or something.
Yeah.
I might be misremembering this. There's some work by
There might be Christina
uh, Vanden
de
Bosch.
Nederlander. Yeah, yeah, the long last name. Yeah,
Yes, yeah, that's right.
who actually might join us as well in the
Oh, great.
future,
Yeah, yeah,
which
she's
would be
fun.
cool.
Well,
Yeah,
good. Then I won't tell you about hers because she'll tell you, and it'll be right when she tells you. Whatever,
well, I
whatever
mean, I
version.
think that has like really strong implications that we are actively trying to figure out where these category boundaries are, and we're doing different things as like kids and adults.
Yeah, and I mean, adults might differ some too, right? I don't feel like this is a thing people look at too systematically because we sort of take these distinctions for granted. But there's a
Yeah,
lot of middle ground. Somebody speaks in a very sing-songy way. Are they singing? I don't know.
and then there's tonal languages as well.
There's tonal
People often forget.
languages. There's like, I mean, there's lots of sort of musical characteristics just in prosodic sort of expression, right? So if you speak emotionally, or if you know, whatever, use different sort of contours for different purposes, right? Like
Yeah,
in some
totally.
contexts that might be musical, right?
Well,
I don't
there's
know.
work from Nina Kraus, and I think you
Hmm.
worked with Annie Patel as well, who came up with the opera hypothesis, which I think is relevant because we're talking about basically music and language as being not really different things when you're a kid. That it's both organized sound, and they're both the brain's ability to discern patterns using the powers of audition and perception and things like that. not to mention like working memory and executive function, attention, things like that, are being tuned by your ability to attend to and reason about and experience these sounds. So it does make sense, I think, for all of us speech therapists to really be thinking about, not separating, let's say, music therapy from speech therapy, especially in early intervention.
Yeah, I think that makes sense. I mean, I'm no therapist, but it also seems to me that like, well, not just seems to me, there's lots of evidence that music can be very highly rewarding, right? And I think if you're dealing with people who are having trouble, being able to give them something that might have some of the skills that they want, give them some practice with that, but in a context that's rewarding and not maybe quite as frustrating, seems like it would be a pretty valuable tool.
Yeah, yeah, totally. And you were mentioning earlier how music affects second language learning, or at least that there's some correlation there. Can you talk a little bit more about that?
Yeah, I mean, actually, this is a nice one to talk about because one of my students just did a meta-analysis on this work where you compile like all the work that's been done on a particular topic and you sort of try to like get a sense of how robust it is and various kinds of statistical techniques, and it seems like it held up, so I feel confident, which is nice. I mean, why is a good question, right? So like so the upshot is, right, if you look at learning second languages, especially as adults, there's a lot of variability, especially in like the phonology and morphosyntax sort of characteristics, right? You can probably think of people who have very like strong foreign accents despite, being really, really proficient in a second language. Other people who like actually pick up accents quite easily. And so why is that, right? And there's pretty good evidence among a lot of different kinds of methods and a lot of different kinds of languages that musicality, which admittedly is hard to define, but predicts that, right? So people who tend to be more musical tend to be better at picking up second languages, especially in terms of the phonology. Does that mean that musical training helps? I mean, that's a good question. And I think there's less evidence on that, right? There's less evidence that there's sort of causal effects, right? It could just be that, people who are good at sound processing are good at both of these things or something. And I think that's, there's a lot of interest in transfer from musical experience to non-musical abilities. And there's a lot less like good, rigorous work because that kind of work is very hard to do. Hard to do well, at least. There's a lot of crappy versions of it, but there's
Yeah.
a less than that. Sorry. I think I lost track of where I was going there. So what did you ask me again?
Oh, no, just about that. So that was perfect. Just that there a little bit more about the relationship between musicality and picking up a second language. And it seems like it, influences, or it might be that just people who are inherently more musical, let's say, are better able to process sound more effectively. So,
if you buy the story earlier that there's like no like super strong difference between musical and linguistic sounds, right? Then it's like, well, if you're good at processing one, you might be good at processing. Like they're just different characteristics of sound, We don't attend to pitch intervals in speech very much. We don't attend as much to the sort of timbral contrast that might make up phonemic contrasts in music. So, but like they're both just characteristics of sounds.
Right.
I mean, that said, we did some work a while ago. I had a student who I was like, oh, we're going to find like tons of overlap in like basic sound processing. So we tried to use like machine learning tools to decode neural representations involved in processing instrument timbres versus speakers' voices. Because speakers' voices are like timbres, right? Timbre is like what distinguishes two instruments playing the same note at the same loudness, right? So if you have
flute and a tuba.
Yeah, they sound well. Flute and tuba is hard for them to play the same note, I suppose. But
right.
Yeah, but sure, yeah, like a violin or a piano or whatever. But like in some sense, speakers' voices are like that too. Like it's just a whole bunch of like spectrotemporal things that characterize individual speakers in the same way that you might characterize instruments. And boy, did we find no neural overlap in the voxels of the brain that seem to, be sensitive to timbral contrasts and speaker voice contrasts.
Yeah, that's so interesting. That kind of something else I wanted to ask about that might be related is a more sort of general, brain science question to you is, with regards to language itself, how neurophysiologically dissociable can we get? I think most SLPs have heard of Broca's and Wernicke's aphasia, for example. But are there things that we know now that sort of challenge that notion, or have we gotten better at defining these systems?
Yeah, that's a good question. I mean, I think, historically there's sort of complementary or parallel kinds of lines of research, right? So there's the sort of neuropsych end of things where people are looking at, patients with aphasia and saying, oh, you have these like distinct patterns of deficits, right? And that suggests, and they're associated at least loosely with distinct sort of patterns of brain damage, and that gives you some idea of localization. On the kind of neuroimaging side, people are, they're trying to sort of map the language networks in some kind of top down instead of based on deficits coming from the bottom up. And I think they've been really complementary. But, I don't need to tell a group of SLP folks that like the diagnoses you might get from aphasia is only going to map imperfectly to like lesion location, right? But in a way, I think that's not surprising. I mean, language is complicated, right? And it's like big networks of things. There's no real reason to think. I mean, I think in general, we've sort of moved away from the idea of things being very strongly localized. Like it was a very nice idea, and it fits really well with some kinds of sort of theories of neural organization, like very highly modular theories. But, it seems like things are much more complicated.
Yeah.
So, but that's okay, right? But I think it does mean it's like, it's hard to, in the same way that language and music are hard to distinguish, like it's actually kind of hard to define even what the critical components of language are, right? Like what has to happen in what order for you to say a sentence or to like understand a sentence, and what are the sort of neural mechanisms that support those things? That's a big question, right? I mean, like I think people for a while were very interested in like rapid temporal processing as this kind of like thing that you might be like really key for distinguishing, I don't know, like stop consonants that differ only in like 20 milliseconds of voice onset time or something. And that's probably true. But, it's going to be like embedded in a whole bunch of other things. Like it's kind of weird to think you would have some chunk of your brain that's like, I care about stop consonants, right?
Right.
Like, it just seems sort of a priori kind of unlikely to me, right? But like you do lots of spectrotemporal analyses. And so how that feeds into later things and how the things interact it's a big question. And one of the things that's challenging is that like, if you look at aphasia, for example, well, here are people who have usually like lots and lots of language experience and they've developed in their own idiosyncratic ways, as we all do. Then they have some kind of damage, which is going to mess that up, right? But it's like, well, it might not be that consistent across people. It might be that you're damaging something that is causing people to do something in a way that isn't how they would normally do it. And then the symptoms you're seeing are less like a function of the damage thing and more a function of like doing something in a way that isn't how you normally would. I saw somebody once give an example of like having a problem with transmission. And so like driving your car backwards to get around, like you can get around and you get around in a weird way, but you wouldn't necessarily say that like the transmission like breaks the forwards part.
Right.
The transmission goes forward, and when the transmission is broken, you can't go forward anymore or something like.
Yeah. So. I love this because, something I've been thinking for a long time is, how helpful is it, the distinctions we made, and how much does it stand up to research? And this is maybe connected to a future question, but like, for example, we have in speech therapy, you can get all of these different diagnoses. Like you can have a syntax disorder, or like a, the phonological disorder versus a, articulation disorder. And like, all of these things that we have symptomatically sort of said like, okay, these things seem to relate to each other. But I think most SLPs will tell you that it does get complicated. Like language is not so clearly, a language deficit is not so clearly one thing or another. Usually there's a lot of overlap, and I wonder how much even our studies can help with that.
Yeah, no, it's a great point. And I think it's like, you got two moving parts, right? Because on one hand, the deficits themselves are probably not like super, they can be, you have like high amounts of comorbidity, or you could have some kind of like, if you're talking about brain damage, I mean, there's no reason to think that even if things were in like little specific modules, the brain damage would be confined to one and not,
right.
on any others, right? And similarly developmentally, like, you get cascading effects of things, right? So I'm sure even if we were right in our sort of theoretical divisions, like I'm not sure it would not surprise me if like the actual clinical diagnoses were still kind of fuzzy. But I think we're probably wrong about the divisions to begin with, right? And so now it's even worse.
Yeah.
But I think my sense is, and I'm not a speech pathologist, but I have a grad student who is one, so I'm learning a little bit, and I interact with a lot of hearing and speech science type folks, and my sense is clinically there's sort of this is true this is true in any kind of medically relevant bit of science. There's sort of the science part, and then there's sort of the practice part, and they're like hopefully mutually informative, but sometimes you sort of are like going with the treatments that seem to work, not necessarily the treatments that like theoretically ought to work, right?
Yeah.
And that's probably important, right?
Well, it's important, yeah, definitely to keep experience as an important part of the equation, because you can easily get misled by some idea that's like, you think, it should work because of this, but it doesn't.
Yeah. And I feel like every time I've talked to speech pathologists about like so many diagnoses are very frustrating from an experimental standpoint, right? We're trying to do some stuff with TBI, and we're like, okay, well, we want like mild to moderate TBI. We don't want like severe. And I'm like, well, how do you distinguish those? And like, there's all these criteria, but whenever you talk to actual speech pathologists, they're like, well, yeah, you sort of just know, you sort of interact with them and you're like, okay, like I see kind of what's up, right? And it's like, there's something that you have learned through experience that is richer than, the diagnostic criteria.
Right. Yeah.
But I don't think you know what it is, right? It's like, it'd be really nice to know what it is.
Yeah. Back to that speech and music distinction in general, like we sort of just know that.
Yeah, right. You can categorize it. And it might be that some of it's contextual too, but like something is speech in one context and music in another, and that's fine. But it's hard to make that part of your definition, right?
Maybe this is getting too philosophical, but it does seem like there's this relationship that we have between the internal and the external. So, it is partly your what you bring to the sound. It's kind of like a John Cage point. Like, like anything can be music, 4 minutes and whatever of silence. Yeah. It could be music if you dispose your attention in the right way. I think most people wouldn't think that that's music, but you can definitely tune how you're thinking about things, but then also, whatever you're getting from the environment is part of the equation. It has to be. So there is that like top down, bottom up approach of everything.
Yeah. It's
yeah. Well, I think that getting back to the sort of experiments, the science experiments, and how we can sort of mutually inform each other as clinicians and scientists. I know that this is definitely interesting to me. Is like what kinds of experiments do you run and researchers typically run to figure out, to kind of tease apart what parts of the language network might be doing one thing or another. I know you mentioned an experiment in your talk about that looks into music and language and like syntax, and how they might be kind of calling on the same systems.
Yeah. People do a lot of different things. Like one sort of section of research is individual differences that people do, right? So you can say, well, are people who are good at one thing good at another, and you get sort of things that track, right? The first thing I ever did on this was my undergrad honors thesis, which was this second language ability and musical ability thing, and we just gave people tons of tests. Like I got these Japanese speakers to come into the lab, like in our basement, and they even like sang karaoke, like little, like not real karaoke, but like I had a little like tape recorder, you record them singing, and then you could like, so you could do that kind of thing.
Fun experiment.
It was pretty good. I don't know if it's one of these things where you can get away with more of that with Japanese speakers than with non-Japanese folks because of deep-seated love of karaoke. But but yeah, and then the experiment you mentioned, like that was a sort of a simple behavioral experiment where we just tried to rely on an interference paradigm. So we just had people read sentences while they were hearing chords, right? And the idea is, well, you can manipulate things about the chords, the sort of structure of the musical sequence that you're hearing, and you can also manipulate things about the sort of structure of the words you're reading, and you can ask if there's sort of interactive effects, right? If hard to process things syntactically are even harder when you have like a sort of surprisingly, a sort of difficult to process musical structural element. And you can compare that. So there we use things like manipulating key. So you hear a chord that isn't like the chord that kind of ought to go there. But you can then compare it to something that isn't structural, like I think we used timbre. So you had a bunch of piano notes and then one was like a pipe organ. That's surprising, but it's not structurally surprising. So that kind of thing lets you sort of tease apart some of these. But people do a lot of neuroimaging too. So you can try to make claims based on neuroimaging overlap or interactions with EEG. So there's a bunch of people who have relied on, should I define EEG? Is this crowd going to know EEG?
Sure. I mean, I think that would be really
why not?
Somebody might. Reminder.
I mean, basically, like the way that like because neurons tend to be arranged in a way where they're sort of oriented the same way, when they fire, they produce a little magnetic field, right? Because they're producing electrical fields that produce a magnetic field. You can measure the electrical field or the magnetic field on the scalp of populations of neurons. It's kind of amazing you can do it, but you can just stick electrodes on your head and you can amplify them a lot, and you get, some kind of average pattern of activity over different parts of the scalp. And if you've heard of like sleep stages, right? That's like some of the early work was on sleep stages, because you get characteristic sort of patterns associated with like wakeful versus rest, stuff like that.
Like delta, theta, alpha, beta, gamma.
Exactly, right. So if you do EEG research, you're always going in there and telling your participants, you're like, too much alpha, wake up, right? Until you're falling asleep because your brain's going, woo. But that's really cool. So, but anyway, you can also basically look at differences as a function of different kinds of things, right? So you can do the same kind of interactive things where if I make you read a word, or you hear a word, or you hear a note or whatever, I can then average like the responses after each one of those notes that you hear, and then I can get a particular characteristic waveform, right? And then I can manipulate things about those and compare those waveforms. And that tells me something about kind of whether the brain is sensitive to that particular contrast and like how early it is, because EEG is very temporally sensitive. Mostly when you think of neuroimaging, you probably think of fMRI, where you're looking at kind of neural regions. That's kind of lousy sometimes for things like language and music, because that's a signal based on blood flow. Really, it's based on the oxygenation of blood flow, like a ratio of oxygenated to deoxygenated hemoglobin, doesn't matter. But the point is, the fMRI response takes 10 or 12 seconds. So if you're doing things that happen fast, like I get a lot of words out in 10 or 12 seconds, right? So if you want to know something about like language processing, you don't necessarily want like the average of like 12 seconds.
Right. I mean, the processing of one speech sound to the next is like,
but you can do some of that stuff with EEG, and MEG and some of these other like more temporally sensitive measures. So anyway, that's the thing. A lot of people with music have used EEG. The other problem with MRI, by the way, is that it's really loud. So if you're interested in spoken language, or if you're interested in music, there's like a little bit of a built-in challenge about being in a machine that's going wah 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 the whole time that you're doing it.
You could like beatbox along with the.
People have. One approach is to try to like set your stimuli up where they have the same rhythm as your scanner.
Oh, got it. Cool.
Why not?
That's interesting.
But yeah, so those like neuroimaging approaches. There's we've done some stuff with deficits too. So we actually published a case study now a while ago on a patient with aphasia. She'd had a stroke and was very severely agrammatic. And my theory at the time was that she should be really lousy at processing musical structure too, which she was not. She was actually very good at processing musical structure. We had to use a lot of kind of implicit priming type paradigms to get at that. But she seemed very sensitive to like the sort of structural properties of Western music. She had a lot of musical experience, a pretty strong musical background. But that was sort of surprising, that kind of dissociation, and that can be,
Yeah. Well, that's so cool. I mean, that implies that there isn't some part of the brain that's processing like hierarchical structure per se, right? That we have a more nuanced.
I think so. I mean, it's always tricky because you're sort of like, well, or is it like something that feeds into that? I mean, maybe you're like, well, if you have problem with sort of linguistic structure, does that mean that the structure itself is not being processed correctly, or that like some of the inputs kind of disordered, or the timing is disordered such that you don't have the information you need when you need it, or whatever. So it's tricky, but I think it does suggest that there's, it's probably not like there's some chunk of brain that just does like abstract hierarchy and doesn't care what it does it over, right?
Yeah. That's
So,
interesting that at least some of the analogies are strong, but might break down in more rigorous scientific study. Like we have the analogy between musical and linguistic syntax.
yeah, I mean, well, I actually think, sometimes it also might be that the analogy is not quite at the right level. Like, I suspect, although I don't know this, but that like musical structure might be really strongly related to linguistic prosody, which also is hierarchical and which maps onto syntax a lot of the time, right? It co-varies with syntax in most languages, but it's not the same. And maybe part of the problem is we've drawn not quite the right connection or something. But I don't know. And also, it's like, these kind of case studies are really interesting. But I think earlier was saying that, or maybe you were saying that, like, there's probably a lot of individual variability in kind of how we represent things like language and music, right? One of the things that's nice about language in some ways is that it has a lot of redundant cues, and that means people can sort of value or prioritize cues that they are better at processing. And so that's good because you want language to be sort of robust, but it's hard because it might mean that you and I might be on the face of it doing the same thing, but like under the hood doing pretty different things, right?
Yeah, that reminds me. I can't remember if this was, maybe it was you that had said this in a somewhere, that like tonal Chinese speakers, for example, like there are a lot of tone deaf speakers of Chinese, even
Yeah.
though they have to attend to the tones, but the tones are large enough that you don't need that granularity to figure out one tone from the next.
I think that's right. It's also the case that, like, it's rarely the case that I say this as somebody who tried to learn Chinese as an adult and was never any good at the tonal bits. And it's rarely the case that you are actually totally like flummoxed without getting the tone information, right? Like, in isolation, you just like give me a single word with no tone. Like, I'm like, well, I don't know. It could be a bunch of things, right? But usually it's in context, and there's a bunch of cues you can use that'll.
Yeah. I think context is so important and kind of underappreciated in most of the things that we do as language therapists.
Yeah, maybe that's true. I mean, I think we're involved in some work with TBI I mentioned before, but part of what we're looking at is dialogue and like sort of following topics and conversations and stuff, because I think that's not it's pretty understudied, not just clinically, but just in general. But
That's so cool. Yeah, can you speak more to that?
Well, what do I have to say about that? This is my grad student, Kelly Marshall, who is great. And she's been working with some folks with us, but also with some folks at Walter Reed, which is, a military medical center here in DC. And so we've been looking at TBI and also in just sort of, neurotypical people to try to understand how they switch between topics in a sort of dialogue, right? Or in a conversation, or even in a monologue, but just in sort of long structured discourses. Because you do it all the time, right? And there's certain kinds of cues that you might use. And if you have TBI, maybe you're not very good at using those cues, but like without really understanding what the demands of shifting between topics are, it's sort of hard to know like what you might try to target for somebody who's having trouble with that, right? And we're really taking, inspiration from the folks in the TBI world who sort of like say, oh yeah, this is like definitely a problem, and here's the sorts of problems they are. And we're like, oh, well, maybe these are hard. So then we're taking it back to like our college undergrads and sort of trying to measure different metrics of like difficulty while they listen to topic shifts. And can they understand, do people even know when topics have shifted, and what cues do they use to know that and stuff like that?
That's so.
I'm being a little vague because it's still in progress and I don't actually know.
Sure. Well, yeah, I'm so curious to hear about that work, because a lot of what we do in social group therapy, for example, little kids too, but is working on topic maintenance. And I've often wondered if there is, if it might just go down to attention or something like that. Like you just lose interest or focus on this thing, and then your brain's already in another place. But it seems like
but if you follow successfully, you build up a kind of hierarchy of your conversation or of the discourse too, right? So we can refer back to something. You've been doing this very well, actually, which I am impressed by. But we sort of refer back to like, hey, this is this point you made before, this point thing we talked about, and it has these relationships. But that means in some sense you have this kind of relationship of like, well, we talked about this thing, but then we talked about that thing, so that I have to say refer back to this in a different way than something that's internal, right?
Yeah, I wonder if that has, back to the speech and music thing, is like, as a jazz musician, you have to be doing that all the time in improv. You're always listening, and you're always trying to pick up on other people's cues.
Yeah, for sure. I think improvisation research is like really fascinating. And people have drawn some inspiration, I think, with some of the work on conversational research, right? So that's cool.
Do you have any thoughts about maybe what might be effective in terms of trying to, I don't know, work on maintaining topics or identifying cues or something like that? Is it down to explicit teaching, or?
I don't know. I mean, it might be useful. It's a good question. I mean, I think Kelly, who's the person running this project, I think she was coming from the kind of idea that this might be, that it might just be one of these things that's cognitively a little tricky to sort of disengage from one topic and re-engage in another, in the same way that people sometimes talk about this with, language switching. Like if you're bilingual and I make you switch between languages, there seems to be a little bit of a cost, right? That's like difficult to do sometimes. Although, big caveat to that, like people do that all the time in natural contexts, right? And it seems to work just fine. But then there's this whole like kind of boring cognitive psychology task switching literature where people make you, you look at like letter number pairs and it like moves around the screen, and every time it's in a particular quadrant, you have to say the number, and other times you have to say the letter, something like that, right? Those are hard to do. And some of those kinds of like prefrontal executive function-y kinds of things tend to be, impaired in TBI, right? So I think she was really thinking we're going to link this to some kind of domain general kind of cognitive control type abilities. So far, our data have not really supported that, actually, which is interesting. Like we find pretty robust switching costs, but not necessarily worse performance in the TBI. Or rather, they show the same pattern. They don't show like exaggerated costs, which surprised us. But still preliminary, so we'll see.
Well, I mean, that's good science.
The other thing that I learned, which you maybe already know, but is when you go to look at TBI in a military context, there's a lot of PTSD you have to sort of contend with, and PTSD predicts a lot of problems. So that's been challenging too. But
sure, yeah. I don't work with TBI specifically, but I imagine that just like in any case I work with, it's like you're dealing with a whole person. So there's all kinds of experience and idiosyncratic stuff that goes along with that.
Yeah, it's the challenge, right? I mean, I feel like this is often, like I say this a lot with music therapy, that music therapy research has not connected very well with cognitive, or really it's probably the fault goes the other way, that sort of cognitive neuroscience work on music has not connected well with music therapy work on music. And I think the reason is that, the cognitive neuroscience in us want to have, 50 randomly selected subjects receiving counterbalanced orders of stimuli of, 100 times each. The therapists are sort of like, well, you can't do this one for that person because that won't work for them.
Right.
The experimentalists are just like, how do you do anything?
Yeah.
It's just different demands, right?
Yeah, I feel like that is a theme emerging, that, a lot of this stuff is just complicated.
It is. But, I think you chip away at it, right? I mean, science is a slow process. But
it is cool to see how you're chipping away. Like you were mentioning the experiment you were doing before with playing certain types of harmonic chord changes, and also doing sentences at the same time. And, for people who aren't familiar with it, there's like an old experimental language paradigm where, you have, I take my coffee with cream and, sugar, something that's expected, and then something that's unexpected, like I take my coffee with cream and dog, I think was the typical example, which now I hear as like normal because I've heard that so many times. But using that as a way to sort of see if they're taxing the same system by looking at, how long does it take you to process this thing.
Yeah,
It's
yeah.
really interesting.
I mean, the other angle on this that is worth, I think, thinking about, at least from a maybe therapeutic perspective, is the reward angle, right? So there's also a bunch of work that links music to reward, and especially musical prediction to award, in a sort of dopamine system kind of way. And the dopamine system underlies learning also, right? And so um, one of the things that that I think is cool is that, like, it turns out that listening to music can make you better at learning things temporarily, right? Like, it seems like it's sort of a mood arousal kind of sort of thing, but I think from a therapeutic perspective, that's sort of interesting, right? Like, because even if you don't necessarily have direct connections, it might be that you're going to get sort of an ancillary benefit from sort of reward type processing. I feel
Yeah.
like I was going somewhere else with that, actually, but now I don't remember where it was.
Well, I'll tell you what. I mean, anecdotally, music has been so helpful for so many of my kids, and
Hmm.
it might just come down to that, where it's like more rewarding and it's fun, so you pay attention more.
Yeah.
But it is harder and harder. I think even as my short 10 years as a therapist has sort of unfolded, the attention span of kids has changed.
Hmm.
At least with I saw as devices became more ubiquitous. And then with the pandemic, where people were more and more spending their time there, it did seem to, at least anecdotally, change how long a kid could attend to something without getting bored.
Hmm.
And music, I just don't think like the typical flashcard thing works anymore. I don't know many therapists who are relying so much on maybe the previous generation's way of doing things. And
Interesting.
yeah, so I feel like the music has been so helpful, um, and for a lot of my kids, on the spectrum too, that maybe struggle with joint attention, and so they're not picking up on the cues, that the sonic auditory cues that might um, differentiate semantic meaning, let's say,
Hmm.
but are drawn to pitch changes in music. You can use that almost as a way in. So
Yeah, there's some work on this in typical kid development too, like linking sort of joint music making to, like, not just pro-social behavior, but also kind of like, I think, some joint attention type measures. I'm trying to think if it's I'm, I'm
oh, that's
I,
cool.
I associate this with Michael Tomasello especially,
Yeah,
but
he's
there's
awesome.
yeah, he is awesome. But he's got some stuff on, and it's cool. It's like they do some little, like, cooperative songs with the kids, and then the kids are, like, actually kind of better at interacting with each other, and they can do it for longer periods of time and stuff.
Well, I mean, that's the whole basis, according to him at least. I mean, that's kind of like the foundation for language is being able to
That's right.
jointly into something.
Yeah.
Uh,
No. No.
yeah,
Yeah. So that stuff is cool too. But
yeah,
yeah, I mean, and again, like, going way back to when we were talking about kind of music and language not being things and maybe differentiating over time. Well, like, if you've got kids, especially if you have kids with language trouble, like, maybe the music stuff is still a little wrapped up in it, and you can kind of get a foothold in there.
yeah, absolutely. I mean, this is like going back to our talk about music therapy and speech therapy, and this is something that I've kind of gone over before with everybody, but like, um, you know, I think that it makes sense, like you're saying, why not use music as something that's really fun and rewarding, organized sound. That's probably helpful. It's definitely not harmful. So, you know,
Yeah, it's definitely not harmful. I mean, I get a lot of comfort out of that. Boy, like, if you give me if I'm going to do a clinical trial and it's a clinical trial of music, I'm like, hey, it's not going to hurt anyone. Like,
right?
at worst, it does nothing. Um, yeah, I should note that, just to reemphasize that it's hard to define these things. Even organized sound gets a little tricky when you start talking about music.
Sure, sure.
I mean, go back to John Cage, and, like, it's not clear that 4 minutes 33 seconds is organized.
Yeah,
It's kind of by definition not organized, right? It's just like whatever it is the audience. Those of you who don't know, you probably all know this, but John Cage has this sort of famous piece that is 4 minutes and 33 seconds of a pianist sitting on a stage, um, like, not playing. They come out, basically open the music and close the piano cover, and then you just wait. And then when it's over, you get up and leave. And it's so that, like, the music is like all of the sounds that happen, and it's different every time, and it's
yeah. Maybe this comes from being at UCSD. Where they have a very um, modern music department, and yeah, I remember doing another John Cage piece where we had to perform his music for 12 radios. And
Oh yeah.
so that we were all in the basement. We were tuning our radios. There's a crazy score that like basically has you turn the different knobs that go to different stations. So you're just getting these random kind of combinations of different music pieces. And I remember just this one moment of all for some reason all of the other radios, like because of the score, had gone silent, and then just like mine was playing Foo Fighters Everlong like really loud. And I was like, this is so funny.
Yeah, that's awesome.
Yeah.
Yeah, I mean, some people will be like, it's not music, but like, I guess the point is, it is for some people, and maybe it isn't for other people, right? Yeah.
Yeah. Yeah. Well, that's so cool. I'm, excited to see, what else you sort of come up with in your studies. But I'm wondering, as we kind of are wrapping up in our last 10 minutes or so, what does the future of research look like to you? And what are you interested in, I guess?
Yeah, a lot of things, but yeah, what am I interested in? I think, one of the things that I think is going to be really important is to kind of go out in the world and get real music and real speech, right? So I think one of the things we've done a lot in the sort of cognitive science world is, generate a set of 50 examples of sentences that have a particular property, and then we have people listen to them or whatever. And I think that's good. I think there's actually a lot to be said for these very well-controlled, tight sort of things. But I also think that we haven't been good about kind of going out in the world and like embracing the complexity that's out there, right? There's more of that than there used to be, but I think there's a lot of room, especially the technology is getting to the point where you can actually capture, lots and lots of naturalistic speech or music or whatever, and you can like do a lot of stuff with that. And so I think that's like an exciting thing that's happening more. And hopefully those sort of traditions will complement each other. Yeah, I don't know what else. I mean, I think, yeah, I don't know. I mean, I'm getting interested myself into EEG and MEG, in part because I think when you're interested in sound, the nice thing with those particular kind of neuroimaging technologies is that they are also like kind of look like sound. I mean, like in fact, you can even take kind of early auditory responses to sound, and you can just sort of like basically throw it back through an amplifier, and it kind of sounds like the sound. Which, like on one hand,
That was
sure,
yeah, yeah.
but it's kind of neat, right? And so you can sort of think about them in similar ways, right? They have a lot of information that accumulates over time. There's no information at any particular point in time, right? Because it's always like relative, like frequency requires some space to exist, right? So, so anyway, I think looking at these with these sort of like time sensitive measures is pretty cool.
Yeah, that point was I remember reading about that in Nina's book, Nina Kraus.
Oh yeah, yeah. Yep. She's done a ton of that stuff.
Yeah, she basically put in, like she had people listen to like Beatles, A Hard Day's Night, and then was able to, you could compare the output.
Yeah.
Someone with a noisier brain, for example, like it sounds more lo-fi.
Yeah. No, that's right. That stuff's cool because it's like it's like subcortical. I mean, it's like brainstem level response, right? And so
Yeah,
talking about cascading problems, right? It's like, wow, if you're just sort of like real basic encoding of the sound very early on is like kind of fuzzy, then it's like, well, it's going to have a lot of cascading effects, right?
yeah, totally.
Yeah, that stuff is
Yeah,
great.
that's awesome. Well, I just wanted to open it up for a few questions.
Yeah.
I know that we had a couple of people that had asked about things in the chat, and I haven't gotten to them. Sorry, my
Oh, yeah.
apologies. Alexandra is asking about a link for some basic illusions. Yeah, I'll add in some of Diana's auditory
She's got some
illusions.
samples on her webpage, I think, that you
Yeah,
can just
I'll
plop in
just throw them in. Here's the web page.
there. And
There's
illusions,
some
by the
really
way,
cool ones.
kind of what we mean, you can think about visual illusions, right? If you've ever seen MC Escher things or whatever, well, like you can do that in audition too, right? It's cases where basically you have some kind of either what you experience is not what you're actually hearing, or you experience something, your perception is something that's kind of impossible, or things like that.
There's one
Like,
that's like just a tone that keeps going up and up forever.
yeah,
That
they use
doesn't
that in
stop.
movies a lot, actually. Like it's a good scary movie sound.
Oh,
Um,
cool. I didn't know that.
yeah, so that you can have these sort of like endlessly rising tones, and like if you know that MC Escher thing of the stairs that look like they always
Yeah.
just keep going up, it's basically that, but in audition. But there's a whole bunch of different sort of things you can do that are pretty cool.
Well, yeah, one thing I asked Diana about was, in the future, if it'd be interesting to do a study where, thinking about a young child trying to differentiate between speech and song is playing that, her auditory illusion of the speech to song. So sometimes behaves so strangely, and seeing if there's an EEG response at the moment where the perception shifts. So you'd start with maybe adults or something, like to see, okay, self-report, when did you start to hear this as song, and then does that map to anything that you can see in an EEG?
No, it's a cool idea, right? And if I'm right that these things only gradually differentiate, then kids should not necessarily have any transformation, right? They heard it as music to begin with, maybe, but I don't know.
Right. And that'd be so cool to know. I mean, like, say if there was something, and then you can start to see at what age kids start to make that categorization and how long it takes them. Would that be related to musical ability later, or even language ability?
No, that's a good question. I mean, EEG in kids is tricky, or at least it's tricky to compare it to like older adults, because a lot of things change about the brain. But I think it could maybe be done. The other reason it's tricky actually is it's pretty sensitive to movement, and kids are really wiggly, as you might know.
Yeah,
some adults are pretty
definitely
wiggly
something. Yeah, true.
But we're working on it. There's now some wearable EEG systems where you can move around in them and stuff.
That's cool.
We're getting there. Yeah.
Well, Sylvia asks, so let's see. She says, "Oh, just some languages are more musical to me than others. So like Spanish and Italian, and she's been singing all of her life. Awesome. Shout out to the musicians in the room." And she also mentions, sorry, go ahead.
No, I say people often talk about languages sounding musical. It's like, in some sense, it's a little bit like the speech to sound illusion, right? Where if you don't know it as well, you can maybe attend more to or notice the musical parts more. I don't know. I mean, I think a lot of people have that intuition that some languages are more musical. That it's like the melodicness of Spanish or Italian compared to like German or something. But I don't know if there's actually evidence that that's true. In like in an acoustic way, right? But I'm actually not sure. I know that there's like been a lot of work on like what they call different sort of rhythm classes of language, and that's always been a little hard to figure out exactly. Like, people like agree that there are different. People used to call them. Now I can't remember what the name is. But there's like these different sort of rhythmic classes of language, but nobody can figure out exactly why. But everybody agrees they're different. Just another one of those weird things.
Interesting. I think I heard also, I heard this from you, but there's a language that is not too many speakers of it left, but Silbo-Gomera or something language, which is
awesome.
That's so cool.
Well, and it's interesting because it's interesting for a lot of reasons, but it's sort of like from the hills of these like farm. I guess they are like herders or something, so they're like really far away. So they can do this whistled version of their language that they have this sort of conventionalized and can communicate because the whistled sound travels better.
That's so cool. Yeah,
it's pretty cool.
Amazing what sort of diversity of languages that there are. I think 7,000 roughly in the world today, something like that.
Yeah, well, and who knows how many have like gone extinct before we even knew about them, right? And like what those are like. I mean, it's pretty wild. And people inventing new. I mean, like you look at like Nicaraguan Sign Language is a super cool example of like these deaf kids in Nicaragua sort of all got dumped into a school for the deaf, and they were going to teach them American Sign Language, but then the kids just sort of like invented their own language, and over a couple of generations, it became this like fully fledged, like highly grammatically complex language.
Wow.
Yeah, totally cool.
That's amazing. I didn't imagine that it could evolve that fast.
Yeah, I think people have now gotten into generation 4 or 5. And it's cool because people were like able to kind of get in there early and start studying and look at sort of the development of systematicity and stuff. There's another one called Albedoan Sign Language, which is somewhere in the Middle East. And that's in a community that has a very high prevalence of like genetic prevalence of deafness. And the community has sort of like created out of thin air their own sign language.
Wow.
It's pretty wild stuff.
Yeah. I would love to talk to someone like an expert in
Yeah.
all
There are a bunch
these.
of people who study like Nicaraguan Sign Language, especially. So I can give you some names later
Cool.
if you want to reach out to them.
Yeah, it'd be fantastic. Yeah, I think it does, show how important early experience is. I think one point that I often make is that like a lot of people, um, sort of in this like Chomskyan way, just sort of feel like, language emerges or something like that, and it's just like teeth or hair or something like that, and it is really part of
Yeah,
experience,
yeah. It's
based
like
on
I think
your
kids like
cultural
want to
context.
learn it. Like there's like a capability to learn it, but you need something. Um,
Yeah,
yeah, I think
yeah.
that's great.
Well, um, yeah. Thank you so much again. Thanks for sharing your knowledge and expertise with us.
Yeah, my pleasure.
Uh,
Thanks for
yeah,
having me, and thanks. Oh, audience that I can't see.
yeah.
For
Thanks everyone for being here. Any last remarks or conclusions? Uh, any asks of the audience?
uh, hmm, I don't know. Keep doing it. It's good work.
Beautiful.
Yeah, I
Thanks.
don't know.
We will keep
Awesome.
doing it. And thank you. And we look forward to seeing you again at another speechtherapypd.com course. Thanks,
Cool.
everyone. This is super fun.
Thanks.
All right. Awesome.